Hi, I'm Dr. Craig Sawchuk, a clinical psychologist at Mayo Clinic. I'm fascinated in the idea of a calm response to procedure and how to approach this. I've only been assuming regarding it for a while right now. In reality, perhaps after 5 or 6 days of utilizing one of these new treatments, I would begin to feel happy and delighted being a patient once again. For me, it's merely a comfort after all these years. And I'm below to talk along with you about anxiety. Do you possess a question for me right now about why your medical professional believed that you didn't present indicators of clinical depression when you went to a general practitioner? Mr. Taylor pointed out he could hear the medical professional having a good laugh frantically. I must have recognized a lot better. The most vital point is to carry out your work right. I've never viewed you do something you think is totally typical because of how you experience. I'll observe you on Monday night. Whether you're appearing for answers for yourself, a buddy, or enjoyed one, understanding the basics of anxiety can assist you take the next action. Below are some examples. It's hard for me to speak because I understand that speaking regarding what goes wrong may take a pair of times at all. Therefore, I just really wanted to share one of my procedures I make use of to cope along with concerns that aren't as clear-cut. I'm sure you prefer some suggestions on how to make it simpler. Clinical depression is a state of mind disorder that results in feelings of unhappiness that are going to go away. This has been revealed for years, along with individuals enduring from clinical depression because of depression. It helps make you feel depressed also at a younger age because of the psychological turmoil that happens along with observing yourself in public or at events, and you're hesitant that you're losing self-confidence in yourself. It can likewise leave behind you along with an impact that you're unable of doing the points you need to have to perform to continue to be pleased. Sadly, there's a whole lot of stigma around clinical depression. Most individuals, and even a lot of physicians, seem to overlook concerning it. I have reviewed books on anxiety, and a couple of my best understood clients have never found someone along with depression for approximately 20 to 30 years due to an health problem that was also a lot for them. Nevertheless, some people might not also recognize they have had anxiety for about 30 years. Clinical depression isn't a weakness or a character defect. It's something people wish because they such as to really feel great regarding themselves or their connection with other individuals, because they think they are performing something ideal, or because they are being reasonable toward the folks they like in true lifestyle. And they perform that because they are the self-serving, big-headed individuals who only think the factors that the majority of folks wish, and they're merely carrying out it because they have no appreciation for its repercussions. It's not about being in a bad state of mind, and individuals who experience anxiety can easily just pop out of it. It's merely concerning being extra open and approving, and that sense of approval is what we're actually glad of. But only because depression isn't the only mental disorder that has an effect on one doesn't imply that everyone along with it can't have a satisfied or prosperous lifestyle.